Hospice care is really designed for those patients that have a prognosis of 6 months or less. They have a terminal condition. They have a situation where really further curative measures are unlikely to produce any improvement in their symptoms or their quality of life. The tenets of palliative medicine are used in hospice care as well. Again, a big focus of what we do in hospice care is managing symptoms, reducing symptom burden for patients to allow them to have the best possible days for them. Now the goals really should be focused more heavily on quality rather than quantity of life. And you know, that the challenge of moving from palliative to hospice is a difficult time for many people, because you know, the H word, as sometimes I'll refer to it as, the H word is very scary because it has a connotation that it hits many patients and families in the face. It in some ways identifies or re-emphasizes to them their own mortality. This means that my lifespan is short. That I've read something or the doctor has said, you know, I'm going to make the referral to hospice. I believe your prognosis may be 6 months or less. So that moving from palliative to hospice care is difficult. One story I tell people now when I see them for a palliative care consult in their home, it's often that one of the first things they'll say to me is, Dave, you're not here to talk about the H word, are you? And my response is, no. While I'm happy to answer any questions about the H word, I'm really here to talk to you and see you today as a palliative care physician. I explain what that's all about. During the conversation, as time lends itself, I will ask the patient and family, so do you think that you could die while you're receiving palliative care? And there'll typically be a pause, and the pause will say, I guess you could. So it softens some of that really difficult, challenging acceptance that many people have with hospice care or even considering hospice care.